Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today, and I see that people are continuing to join our webcast, so let's give them just another few seconds and then we will get started. Thank you to all of you who are joining us on GoToWebinar, Facebook Live, and YouTube Live. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our expert today, please feel free to post your questions on Facebook and YouTube or type them into the questions box if you're joining us on GoToWebinar. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. Quality sleep is important to maintaining overall health and wellness, but sometimes getting quality sleep is easier said than done. Research suggests that over half the people living with MS report significant disruptions in sleep and difficulty maintaining a consistent sleep schedule. We're talking with Dr. Katie Siengsukon, a physical therapist, an associate professor, and the director of the Sleep, Health, and Wellness Lab at the University of Kansas Medical Center Department of Physical Therapy and Rehabilitation Science. Welcome, Dr. Siengsukon, and thanks for joining us today.
Thanks for having me.
Well, sure. I think we've all experienced those sleepless or restless nights where we toss and turn and feel the time slowly ticking away. And then there are other times when we feel like we're sleeping way too much. Given the heightened stress in our world today, quality sleep has become a real challenge for so many people. So I'm hoping you'll get us started today by explaining why quality sleep is so important to our overall health.
Absolutely, and I'm really excited to be here today and talk with this group. And I think there's a lot of interest in understanding sleep and understanding how sleep, and particularly good sleep quality, is important for our health. And sleep it's pretty much involved with every system of our body. So if you're not sleeping well, meaning you're not getting sufficient quality sleep, that's going to impact a lot of different systems. So we know that our immune system is affected if we're not getting good quality sleep. Also, our ability for our tissues to heal is also impacted if we're not getting good quality sleep. There's a lot of interest in the relationship between sleep and pain modulation. So there's evidence that if you're not sleeping well, that ability to modulate pain within the brain is disrupted. Of course, sleep's also been heavily involved with cognitive function. So if you're, again, not getting good quality sleep, it's a lot more difficult to make decisions, to pay attention, to process information. Sleep is also important for learning and memory formation. So there's thoughts that while you're awake and you're learning new information, and then when you go to sleep, that information gets strengthened and consolidated into your memories. And sleep's also important for helping to flush out substances that can build up during the day. So like beta amyloid is a risk factor for Alzheimer's disease. And so there's a risk that if you're not sleeping well, that beta amyloid is more likely to stay in your brain and it puts you at a higher risk of Alzheimer's disease. So really sleep, again, it's important for pretty much every system of our body, and not getting sufficient quality sleep over a prolonged period of time does put you then at a higher risk of developing various chronic conditions like cardiovascular disease, obesity, diabetes, Alzheimer's disease. And so absolutely adequate quality sleep is a very important critical even for our health and our wellness.
Well, we're using the term quality sleep. So what does quality sleep look like?
That's a good question. And it probably is going to depend on who you ask. I think sleep quality is probably one of those terms that, people kind of use, and they use it in different ways. When I am referring to quality sleep, it can be assessed, very subjectively. So we have various questionnaires where we assess sleep quality. And so really then it's the patient's perception of what their sleep quality is like. So if I could say, how would you describe your sleep quality? And you would probably be able to say, oh, it's very good, it's very bad, or it's somewhere in between. We also have some objective ways that we look at sleep quality. And then the way we define it is the amount of time that you're actually sleeping divided by the amount of time you're in bed, and we times it by 100. And so basically, like, how much sleep are you actually getting when you're in bed? And if it's greater than 85%, we consider that to be good sleep quality. But I think what's important to note is that the way people perceive their sleep quality isn't necessarily the same as our objective measures. And so that's why we always assess both, because they're not, while they're associated, they're not exactly the same thing.
Are there particular benefits of quality sleep for people living with multiple sclerosis?
And I would say, considering the role of good quality sleep and all those the body functions that we talked about, but specifically for people with MS, fatigue is such a huge issue in people with MS. And not that sleep quality and fatigue are the exact same, they're not the same construct. They're different things. They're measured in different ways. They're not the same thing, but they're definitely very related. And so we have found in some of our research studies where we do a behavioral intervention, and when we're able to help people sleep better, so they're getting better quality sleep, we're reducing their insomnia symptoms, then that does have a positive benefit on their fatigue, but also their depression and anxiety, which is sometimes common in people with MS as well. Pain is oftentimes an issue, and so I would think that would be particularly relevant for people with MS as well. So things like the fatigue, the depression, pain that is very common in people with MS would particularly be benefiting from making sure they're getting adequate quality sleep.
I know the term sleep disturbance is a general term that describes a wide range of sleep-related symptoms and disorders. What does it normally include?
So I would consider sleep disturbances to be a fairly broad term, whereas, sleep disorders would be more of those medical conditions, those sleep disorders that you get diagnosed with. So like sleep apnea, insomnia, restless leg syndrome, whereas sleep disturbances is more global. And, that it certainly could be due to a sleep disorder, but you can also have disturbed sleep because, your dog is keeping you awake, or maybe you have children that are waking you up, or, there's some environmental noise that is waking you up. So just because you have sleep disturbances, or maybe, you're waking up to go to the bathroom throughout the night, that disturbs your sleep. But if you're able to get back to sleep relatively quickly and easily, it wouldn't necessarily be considered a sleep disorder in that regard.
During times of stress, like, for instance, right now, when we find ourselves in the midst of a global pandemic, what types of sleep disturbances can people typically experience?
Yeah, that's a wonderful question. And it's fascinating because when when the pandemic started and started to really impact people, here in the United States in particular, because we have a couple research studies going on right now. We have a study actually going on in people with MS doing this behavioral sleep intervention, and then we also have a study in older adults. And I had kind of figured that a global pandemic with the anxiety, the stress, potential loss of work, the, social disconnections that are happening, I had kind of assumed we would be having an influx of people with insomnia, and being interested in being in our studies. And in some cases that has been true. I think I don't want to diminish that this pandemic has been very stressful for a lot of people for different reasons. But what's also been interesting, and that I hadn't necessarily considered, is that for some people, being able to work from home, being able to have a more flexible work schedule. And for some people, that's actually been advantageous for their sleep. So instead of having to wake up at 6 a.m. to go to work, now maybe they can sleep in a little bit because that's more of their natural circadian rhythm or of their natural sleep preference. So for some people, perhaps not the pandemic itself, but the resultant more laxity in their sleep schedule has been actually helpful for their sleep. But absolutely the stress and the anxiety that's come with the pandemic has been very disruptive for some people as well. So it kind of depends on the person, really.
Well, it's refreshing to hear about something that the pandemic has not severely impacted. So that's actually good news. Why are sleep problems common in people with MS?
So sleep problems, they can be due to the MS itself. So due to the disease and the way that it affects the brain, if it's affecting the areas of the brain that are controlling your sleep, the MS itself can disrupt sleep because of the way that it's affecting the brain and those brain centers. But probably what I see most often are the comorbid issues that people with MS oftentimes have that is disrupting their sleep. So things like spasticity, that can be disruptive to sleep, pain. I think the fear, the anxiety, the stress that comes with having a chronic condition is also particularly troubling for people with MS, understandably so, but that in of itself can be very disruptive. So I think it could be multiple reasons, if it's the MS itself or if it's because of the other issues that oftentimes are resultant of the MS. And then the nighttime need to get up to go to the bathroom, I see that with a lot of patients as well. So really you have to kind of, get to know the person and understand, what is it that could be contributing to their sleep issue, and then helping as best we can to address perhaps those resultant sleep issues that could be contributing to their sleep as best we can.
Jeff has reached out and he says that recently he's been struggling with getting enough sleep. His vitamin D levels have been low, so his doctor has put him on a supplement. And Jeff's wondering if low vitamin D could be contributing to his poor quality of sleep.
It can. There was a recent systematic review, so a study where they pulled all the papers that have looked at vitamin D and how that impacts sleep. And there weren't very many, I think, is the first thing to note. But those few studies that they did find did suggest that a vitamin D deficiency can, in fact, impact sleep quality. So people who are vitamin D deficient might have difficulty falling asleep or difficulty staying asleep, or they may have more disrupted sleep. But that being said, I do want to issue kind of that caution of, there weren't that many studies included, and that they tended to have kind of a small sample size. But preliminarily, it does seem to indicate that lower levels of vitamin D may contribute to sleep disruptions. And I think that points to the need, if you are having disrupted sleep, to make sure that you're talking with your physician about it. So that way they can do, a full workup, including, things like vitamin D, other potential contributors, but that could be one of them.
I think you've already started answering my next question. I was wondering whether there are other health conditions or other deficiencies that can cause sleep problems.
So we've talked about vitamin D. So iron levels is another thing to consider. That's been associated with, if you have insufficient iron, that's been associated with a sleep disorder called restless leg syndrome. And so that is oftentimes, again, what a lab that will be done by physicians to see the person's iron level, both because of how iron apparently impacts dopamine within the brain, which is a neurotransmitter in the brain that is one of the neurotransmitters associated with sleep, but it does other things as well. And so oftentimes they'll check iron levels along with vitamin D. And then there's some evidence that magnesium is another factor that could be considered. But I would say right now, those are kind of the three that are oftentimes considered. And then too, with your physician will still look to see, could it be your thyroid? Could it be any other, health condition that might be disrupting your sleep? And then, because obviously you want to address the underlying cause as best that you can, and making sure that you're addressing those issues is the best thing to be helping with your sleep.
Dr. Siengsukon, I know that your research interests are aimed at understanding how sleep impacts physical and cognitive function, learning, and our overall health. Can you share some of the things that research is helping us better understand?
Absolutely. And I think what's so fun about being a researcher interested in sleep and studying sleep is that there is so much interest, and that to me is exciting, that there's a lot more emphasis and interest in understanding sleep. So a lot of research that is happening, is coming out here recently. And so that is really fun to see what everybody's doing. Our research is focused on a behavioral intervention called cognitive behavioral therapy for insomnia. And so that is a specific intervention that is targeted to people with insomnia. And so we are currently doing a study, I mentioned, in older adults, to see if it improves cognitive function and reduces beta amyloid accumulation, because again, that's one of the precursors or the issues that can put you at risk for Alzheimer's disease. And then we've also done several studies in people with multiple sclerosis. So we've done CBTI in person. So that's kind of your standard CBTI protocol, is where the person comes in, they see a provider one-on-one, one time a week. We did a program for 6 weeks. It's usually between 4 and 8 weeks. And so we've done it in person. We now have actually done a web-based program as well. There's several web-based programs where it's more automated, because what we found with our in-person study, while yes, the people who were able to enroll in the study, access our program, come into my laboratory, most of them had improvements in their insomnia symptoms, their fatigue, their depression, their anxiety. What we were finding is that there were a lot of people who, were not necessarily in the surrounding area, and so weren't able to come into the lab. And so we wanted to then be able to scale the CBTI intervention. And so we partnered with the Cleveland Clinic. They have a web-based program that Michelle Drerup has created. And so we did a study using this web-based program, and also showed that it is an effective way to improve insomnia symptoms in people with MS. Not quite to the same extent as our in-person program, but I don't think that's a huge surprise. There's some pros and cons of doing things in person versus using these web-based programs, but it kind of has led us to wonder if doing a stepped care approach would be a way forward for people with MS, because we definitely had some people who did the web-based program and their insomnia got better. And then there's some people who they did the program and it didn't get better. So then ideally, those would be the people that would go to an in-person provider. So that, I think, will be our future studies. And then we're actually doing a telehealth intervention right now. Again, due to the pandemic and people having difficulty coming into the lab, we wanted to see if doing it, via web-based or a conferencing program, if that would have similar impact on insomnia as well. So yeah, we've done several studies and have shown them to be effective in people with MS.
We've heard from Christian, and Christian says that he was diagnosed with MS 2 years ago, and he feels like the stress of receiving his diagnosis has impacted the quality of his sleep. Sometimes Christian gets a good night's sleep, and other times it's very difficult. He ends up tossing and turning all night. Christian wants to know how he can tell if he should get some help. So when is the time for someone to discuss their sleep problems with their doctor?
And this is unfortunately something that I see in the clients that I work with, is that, oftentimes in people with MS, it would be very stressful. I would imagine it would be incredibly stressful to have a chronic condition. And I hear that often in the patients that I work with is how stressful that is on them, on their family, issues with accessing care. I mean, we could list all the reasons why it's stressful, but absolutely, it's very stressful. And as far as, when should you talk to your doctor about it? I would say if your sleep issue is happening on a regular basis, then that is absolutely the time to be talking to your doctor about it. What I hear in the clients that I work with is that, they only have so much time when they go to see their doctor. And oftentimes there's other issues to talk about, that maybe they deem more important, or, they don't think the sleep issue is maybe elevated enough to where they need to mention it to their doctor. And so they don't. And I hear that a lot. And so I think if that's one thing that, we can encourage people is that if you are having sleep issues, again, more than every once in a while, because we all have sleep issues. I mean, every once in a while, we have stressful days, or, the dog's barking, or the kids are waking us up. But if it's happening on a regular basis, then absolutely. Mainly because, there's things that we can do to help people sleep better. But then also too, because sleep disorders oftentimes go undiagnosed, including in people with MS. There's been studies that show that it's hugely undiagnosed sleep disorders, being insomnia, sleep apnea, restless leg syndrome. And so if you have a sleep disorder and it's not being treated, then it's most likely not going to go away by itself. And, for sleep apnea, you probably need to be on some sort of a device to help keep your airway open. Restless leg syndrome, having labs drawn to see what's causing it. And again, with all of them, there are treatments that you can undergo that can be very effective. But I see people being hesitant to mention these sleep issues. And I would encourage people to elevate them to maybe being the number one thing that you want to talk to your doctor about, or, at least high up there on your list. So that way your doctor's aware of it, and you can talk about what would be the best steps forward as far as assessing and potentially treating your particular sleep issues.
Do you sometimes get the impression that people don't bring up sleep disorders or sleep disturbances because they don't have an awareness that they can be treated?
I mean, I think that's one thing, that people will sometimes say is like, oh gosh, I didn't know that there were these treatments for insomnia. I thought I just kind of had to live with it. So there probably is some, education needed about, yes, there are these effective treatments, and again, I think sometimes people too, I see this in older adults, I see this in people with MS. Again, for older adults, a lot of times they think, oh, I'm getting older. This is just a natural part of aging. And, and yes, we do see some changes as people age, but you still should be getting quality sleep. And if you're not, you need to talk to your doctor about it. And same thing with people with MS. I hear them say like, well, gosh, I have spasticity, or I have pain, or I have to wake up to go to the bathroom. How is my sleep ever going to get better? And then talking through, here are some strategies for your spasticity or for your pain, or, some behavioral techniques that you can try that may help get you into a deeper stage of sleep, help reduce your number of awakenings at night, and again, can be very, very effective. So don't hesitate to mention your sleep issues to your doctor.
Well, I want to thank you, Dr. Siengsukon, for helping us better understand the whole idea of how sleep can impact MS. And before we get into discussing strategies to manage those problems, I want to take a moment to welcome those of you who've continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the questions box if you joined us on GoToWebinar. By the way, our Ask an MS Expert event takes place live at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. We're talking with Dr. Katie Siengsukon from the University of Kansas about some of the common sleep difficulties people living with MS might experience. I'd like to change gears a little bit now and focus on healthcare professionals go about evaluating sleep problems, and then we can look at some strategies for managing sleep disturbances. Dr. Siengsukon, can you tell us what types of healthcare professionals help addressing sleep disturbances?
So probably the most common healthcare professionals are probably the ones that you would want to be bringing your sleep issues to would be your primary care physician, and then also your neurologist would be the two that I would recommend, so that they can, again, evaluate your signs, your symptoms in the context of your MS and help guide you to what would be the next steps in the assessment and potentially the treatment of whatever your sleep issues are. There's neurologists that are board certified in sleep medicine. And so seeing a specialist may be what you get referred to or who you get referred to. And then also too, psychologist and psychiatrist can specialize in sleep medicine as well. So oftentimes it's psychologists who are doing this behavioral intervention called CBTI. I am somewhat unique. I'm a physical therapist, and there's not many, if all at all, physical therapists who've been trained in CBTI. So I'm guessing a lot of the audience and some of the listeners have seen a physical therapist. And so, you may be wondering, well, why hasn't my PT talked to me about that? And most of them have not had similar training. But we can, occupational therapists sometimes are people who are educating on sleep issues as well. So there's kind of a variety of people, and they serve slightly different roles as far as the diagnosis and then the different treatments that you may undergo.
While we're talking about assessing sleep problems, are there standardized assessments to evaluate someone's sleep?
There are, and oftentimes, again, if this is being done by a physician, they would kind of do a full workup. They obviously are going to have questions to ask about describing what your sleep issues are like. How much sleep are you getting? How would you describe your sleep quality? So kind of more of those subjective types of questions. How often are you having these issues? And then there's screening tools that can be used. There's different questionnaires that can look at risk of having different sleep disorders. And then, based on kind of your signs and your symptoms, based on perhaps these standard questionnaires, then you may undergo an overnight sleep study called polysomnography. And those can actually sometimes be done at home. There's now devices that are about as good as doing it as in an overnight sleep lab. So you may be sent home with a home unit, or you may go into a sleep laboratory and do an overnight sleep study. And that can be both to diagnose you for having a sleep disorder. So like sleep apnea would be diagnosed on an overnight sleep study, periodic movement of sleep. But then also the sleep study can also help to rule out those issues and see then if it is, insomnia instead. So insomnia is more of a case where you're ruling out other sleep disorders. So that's usually kind of the progression of the assessments that would be used.
So who is the right candidate to get a sleep study?
So the right candidate would be the person who needs it. So again, going through your signs and your symptoms to determine, are there other underlying issues that it could be? So again, do they do lab work to see if it's an iron deficiency or vitamin D deficiency? Is it your spasticity that needs to be better addressed, or managing your medication? Is it pain that needs to be better addressed? And so in those instances, if the physician is fairly confident that it's those underlying issues, then I would imagine they would be trying to treat those. But if it doesn't seem like it's those underlying issues, or if you, again, score at risk of having sleep apnea. So for example, if you snore, if you're overweight, if you are taking medication for high blood pressure, if you're over a certain age, those are all things that put you at a higher risk of sleep apnea. And so then the physician would decide if depending again on your particular circumstances, if doing an overnight sleep study would be warranted.
Are these assessments, including sleep studies, something that are normally covered by health insurance?
They typically are. the assessment of your sleep, again, in your physician's office would be part of your visit to your physician. And then typically, if the overnight sleep study is indicated based on the physician's assessment, then those are typically going to be covered by insurance. I mean, obviously, with any procedure, you would want to be ensuring that your insurance is going to cover it ahead of time. So if there's any question about that, I always encourage people to call your insurance ahead of time, so that way you know that it's going to be covered, or to what level it's going to be covered.
Rebecca wrote in saying her doctor advised that she work on her sleep hygiene to better manage her MS. So Rebecca wants to know what exactly sleep hygiene is and what are the things that she can do to improve it.
Yeah, so sleep hygiene is such a funny phrase, I think. So I like to call it sleep promotion techniques, because I think hygiene just kind of sounds awkward. But usually what people mean by sleep hygiene is it's the behaviors in the environment that promote good sleep. So behaviors being like having a regular bedtime and wake up time. If you're in bed, you're sleeping and you're not doing other activities in bed. Things like avoiding naps if possible. Environmental things like keeping your bedroom as dark as possible, reducing noise, keeping the bedroom cool as best you can. And then things too, like avoiding caffeine, being cautious of alcohol, because alcohol, there's a lot of misconception about alcohol that it can help you fall asleep, but it actually is more disruptive to your sleep. And so those kind of would all fall under what would be considered good sleep hygiene.
What other interventions should our audience consider to help with sleep problems?
So first of all, it would be important to know exactly what's, again, causing the sleep problem and making sure that that's being addressed, or if you do have a sleep disorder, appropriately treating it. Because some of these recommendations, so for example, if you have sleep apnea, you could do all these sleep health promotion techniques, but that's not going to keep your airways open. You really need to be on a CPAP or a BiPAP or an oral appliance that is helping to keep your airway open. So I would first say, making sure that you're considering those underlying issues and an underlying sleep disorder. But absolutely, the things that we've talked about as far as having a regular sleep schedule, that's really important. So things that we focus on for our behavioral intervention is we focus on trying to strengthen circadian rhythm and strengthening your sleep drive. So those are the two physiological drivers of sleep. So in the way you strengthen circadian rhythm is, again, having a really regular sleep schedule, and particularly paying close attention to your wake up time, having that be really regular. And then exposure to light is also very important in the morning, because light tells your brain it's time to wake up, and then darkness tells your brain it's time to sleep. So when you wake up in the morning, you want exposure to bright light to help tell your brain it's time to wake up. But then you want your bedroom to be super dark when you're trying to sleep, so that way your brain is like, oh, okay, it's dark, I should be sleeping. And then the ways to strengthen sleep drive are things like, again, trying to avoid naps unless you need a nap. Things like getting enough physical activity and exercise. Those also help to increase sleep drive. Being cognitively active, so using your brain in ways that challenge yourself. And then again, thinking about the environment to make sure it's cool, it's dark, you have comfortable place to sleep are all important things to do. And then too, I haven't really touched on, we've talked about the two physiological drivers being circadian rhythm and sleep drive, but then it's also very important to, because we sleep for maybe 7-8 hours. So we're awake then for a good chunk of the time of that 24-hour day. And so making sure you're also reducing your what I call pre-sleep arousal is also very important. So having a regular bedtime routine to help kind of reduce that stress, reduce the activity of your sympathetic nervous system is also very important. We focus a lot on relaxation techniques because again, you want to make sure you're kind of keeping that stress throughout the day and that sympathetic nervous system activity during the day at a as low as a level as you can. So that way, when you do get into bed, now you have a really strong circadian rhythm, you've got a really strong sleep drive. So hopefully then you get into bed and you fall asleep quickly and easily. So relaxation techniques that we focus on, and there's lots of them. It's not that these are the end all and be all, but the ones that we focus on are deep breathing. So we do 5, 7, 8 breathing, where people breathe in for 5, hold for 7, and then exhale for 8. We also focus on mindfulness. So that concept of being in the present moment, being non-judgmental, is very, very helpful for people who have sleep issues, and particularly insomnia. And then we also do progressive muscle relaxation. So those are the 3 that we tend to focus on. But again, there's other types of relaxation techniques as well.
I've heard you mention your work looking at cognitive behavioral therapy as a way of treating insomnia. Can you tell us what cognitive behavior therapy is, and tell us what you're learning?
So with CBTI, cognitive behavioral therapy for insomnia, and some of it is including things that we've talked about. So we focus on the behaviors. So that's the B in CBTI. So we focus again on strengthening circadian rhythm, and strengthening sleep drive by coaching people to develop a regular sleep schedule. We also focus on so we focus on time in bed and how much time are people spending in bed, because a lot of times what is happening in people who have insomnia is they end up spending more time in bed in the hopes that they fall asleep, or then the hopes that they happen to fall back to sleep and get more sleep. But that actually can be detrimental to your sleep, because then if you're just laying in bed awake and perhaps now are anxious that you're not sleeping, your brain starts to associate your bed with being awake. If I have people a lot that will say, like, gosh, I was so tired, and then I went to go get into my bed and I was wide awake. And so we call that conditioned arousal. And that's because your brain now is associating your bed with being awake. So we reduce the time in bed. So some people call that sleep restriction, but really you're not reducing sleep per se, you're reducing the time in bed. We also focus on stimulus control. And so that means if you are in bed, you're sleeping, because again, we want the brain to associate the bed with sleeping. So if the general rule is if you're not asleep within 15 to 20 minutes, or you start to feel anxious or worried that you're not sleeping, which for some people that happens within a minute or two, then the recommendation is to get out of bed and to go somewhere else and do something relaxing. Now, I will say with my clients with MS, I'm very cognizant of fall risk and mobility limitations. And so for people that there's concern about falls or, again, mobility issues, then I do not have them get out of bed to do stimulus control, but instead they do relaxation techniques or techniques for distraction in bed. And so then again, once you've done that for 15, 20 minutes, you feel adequately tired, and then you attempt to sleep again at that time. So those are kind of the big behaviors. And again, we would talk about sleep hygiene, which we've kind of talked about, and then going through the techniques to reduce daytime arousal. So going through the different relaxation techniques, focusing on environment. And then the other thing, so those are kind of all the behaviors. That's the B in CBTI. And then there's also the cognitive piece, which is an incredibly important component of insomnia, or at least it can be for some people. And so then that would be focusing on kind of those negative behaviors or those negative thoughts that are surrounding their sleep. And so for people that are listening and they've had insomnia, they can probably relate to, being worried about their sleep or being anxious about their sleep, or, kind of, again, having these really negative thoughts surrounding their insomnia and their difficulty sleeping. And so we have some different techniques that we use to kind of help address those negative thoughts and kind of help redirect them in various ways. So it's the cognitive and it's the behavioral pieces.
Besides CBTI, are there other treatment options available for sleep disturbances?
So there are, and again, it really boils down to what's the cause of the sleep disturbance. And so that's why having that assessment is so important, to identify what's causing it and then addressing, what that particular issue is. So if it's, low iron, having an iron supplement, if it's your spasticity that's disrupting your sleep, then talking about, the timing of your medication, or the type of medication, or the dose of your anti-spasticity medication. Being a physical therapist, I'm also, equipped to help people learn to exercise, and exercise appropriately and safely. And so I feel like that's an advantage, is not only being able to incorporate CBTI, but then also the exercise piece, because we do know that exercise and being physically active is good for lots of reasons for our health. But studies showing that exercise and being physically active does actually help you sleep better too, because it helps to build up that sleep drive. So sometimes I'm also coaching people on how to exercise or be more physically active throughout the day.
Well, you've shared a lot of helpful information today, Dr. Siengsukon. What would you say are the top 3 takeaways that our audience should keep in mind?
The top 3, I only get to pick 3. So I think the biggest one is to talk to your doctor if you are having sleep issues. Like, to don't diminish your concern about your sleep. Like, if it's concerning to you, then please bring that forward to your doctor, because there likely is something that can be done to help you sleep better. And then maybe that follows in my second main point, is because we know that sleep is so important, for people with MS, because of its relationship with fatigue and depression and anxiety and being physically active, and, and wanting to be socially connected. I think, for people with MS, it's important, but then, for everybody, it's very important because of how it impacts all the different systems of our body. And then my third main takeaway maybe is just that, you can do something about it. Don't be sitting there thinking that there's nothing that can be done, and it's just a normal part of your MS, and it's just a normal part of aging. And so I guess that loops back to number 1 of talking to your doctor about it.
Well, thank you, Dr. Siengsukon, for helping us better understand sleep disturbances and the steps that someone should take to manage them. Now, I'd like to focus our time on addressing more of the questions that our viewers have for you. We have received lots of questions about symptoms that worsen at night and therefore make sleeping difficult. Christine wants to know how to help when symptoms like neuropathy affect sleep. And Andrea asks how she can stop her restless legs when she's trying to sleep. So what advice do you give the patients you're working with for managing these symptoms that get worse at exactly the time that it's time to go to sleep?
Yeah. I mean, I think, first of all is making sure that those issues are being treated. If you are having neuropathy, there's medication to help with neuropathy. Can positioning help, or that, what are some strategies that can be helpful with your neuropathy? And for some people, that does mean medication. As far as a restless leg, is it an iron issue? There are medications then that can help with restless leg syndrome. Exercise is also very effective. So for a lot of people with MS that I've worked with, sometimes we are then talking about, what are effective treatments for those underlying issues, and perhaps revisiting that treatment with their doctor. Does the medication need to be changed? If it's not being effective, does the dose need to be increased? Does the timing of the medication, sometimes it's a timing issue, because if those symptoms are increasing at bedtime, sometimes if you just change the timing of it, again, after talking with your doctor about it, then that sometimes can be very helpful. I also, for some people who we've worked with CBTI, going through the intervention actually does help with some of those symptoms. So maybe the best example is for people who have to get up to go to the bathroom because the MS is affecting their bladder. So oftentimes I'll have people say, well, gosh, I'm waking up 3 or 4 times to go to the bathroom. And, how is this intervention going to help that? It may and it may not, but for a lot of people, by doing CBTI, it actually helps them get into a deeper stage of sleep, and it helps them consolidate their sleep. So then it can be they actually are able to stay asleep longer, and they don't have as disrupted sleep. So for the person who's waking up to go to the bathroom, sometimes it's, their sleep got disrupted, for whatever reason, and they wake up and they're like, oh, I guess I need to go to the bathroom. I guess that's what woke me up. But really it was because they were already waking up for another reason. So CBTI can be helpful for that. For those that it doesn't help, then again, it's that conversation of talking with your doctor of, changes of medication or the timing of medication, because it could be that the multiple sclerosis is affecting their bladder to the point where it truly is waking them up at night, and they do have to get up to go to the bathroom. And then there are effective medications for that.
We've also received some questions about sleep and MS fatigue. Izzy wants to know why she wakes up very tired after sleeping for so many hours. And we've heard from others who are asking how much sleep a person with MS should be getting each night, and if sleeping more or sleeping less is better for fatigue. What can you tell us about MS-related fatigue and sleep? Mm-hmm. And I guess two-part question, and is there a recommended amount of sleep to help combat MS fatigue?
So maybe I'll start with the second question first. So the American Academy of Sleep Medicine recommends that adults get 7 or more hours of sleep each night for optimal health. And so there's not necessarily a distinction or a change for people with MS. It's this, 7 or more hours. They used to cap it at, 7 to 9 hours, but they've gotten rid of the upper limit. And so now it's 7 or more hours is the recommendation for adults. And so then to circle back to the question about MS and fatigue, so I think sometimes, these two constructs they're very associated, they're very interwoven, but they really are two different constructs, where fatigue is its own entity and sleep disruptions or sleep quality is its own entity, but absolutely they are related, so if you are not sleeping well, it most likely is going to make your fatigue worse. But you also can have those instances where you are getting what appears to be good sleep, but yet you still are highly fatigued the next day, because again, those are different constructs. They're related, but different. I would also wonder, if what that individual would mean by they're getting, good sleep. Because for some people, and this is fascinating, is some people, they don't know that they have a sleep disorder. They don't know that they're having periods of time where, they're stopping their breathing, or they're having shallow breath, which would be sleep apnea, or they don't know that they're moving their limbs throughout the night, which would be periodic limb movement asleep. They don't know that they have a sleep disorder. So for some people, they actually think, they're like, gosh, I slept for 8 hours or maybe even 9 hours, but I'm still waking up feeling, really fatigued or really tired. And so those would be the questions, again, talking with your doctor to say, well, gosh, maybe you do have a sleep disorder. So even though you think you're getting good quality sleep, maybe you aren't. But in our research studies, we have shown that by helping people sleep better using CBTI, that not only does help with their insomnia symptoms and their sleep quality, but it also does help people with MS with their fatigue. So again, they're related, but not the exact same thing. But sleeping better, can be helpful for some people.
We've heard from Karen, who says she has to sleep with the air conditioner on, even when others in her house are comfortable without it. And Mike, and actually many others who are joining us, they want to know if night sweats are common in MS. What about these temperature fluctuations that some people with MS experience while they're trying to sleep, and are there ways to manage them?
Yeah. So with MS, it affects all the different nerves within your central nervous system, right? So it's affecting that myelin of the motor pathways, of the sensory pathways, which is why you can have motor impairments and sensory impairments. But it also can affect the areas of the brain that control your autonomic nervous system. And so that is the system that is controlling those night sweats and things like that. And so people with MS can experience, disturbances because of night sweating, and that's not uncommon, unfortunately. And so recommendations for people who are experiencing that nighttime temperature fluctuation, particularly the night sweats. One recommendation is, obviously to keep the temperature cool within your bedroom. Not covering up with a ton of blankets, and having blankets that you can take on and take off depending on how you're feeling. Other recommendations, and this may not necessarily change that you have woken up sweaty, but is to have like a change of clothes nearby, so that way if you do wake up sweaty, you're able to quickly and easily, and hopefully without disrupting your sleep even further, change your clothing. Or some people will put like a towel down, so that way again, if they wake up, they're able to take the towel off, lay another one down. Another strategy that can also be helpful is that relaxation, because that relaxation, practicing it during the day, can be again very helpful to reduce that activity of the sympathetic nervous system, which is going to be what is going to be overactive at night and making you sweat. So those can be effective to help hopefully prevent those night sweats from happening. But then if they do, again, having kind of those strategies prepared ahead of time. Oftentimes what I see too is people who are experiencing this, the night sweats, because it is disruptive to your sleep, is the frustration that comes with it. And so then sometimes it becomes not just the night sweat that is disrupting their sleep, but really it becomes that frustration. And so I think then again, being mindful that they're feeling frustrated, using techniques to reduce that frustration, meditation, mindfulness, kind of these different relaxation techniques to help it then not be even more disruptive than it already is. Which again, I know is easier said than done, and it does take some practice in order to not be so frustrated with the night sweats, or nighttime urination for that matter as well.
Well, while you and I have been talking, Julie Fiol has been working hard in the background, fielding questions from the people who are watching. So, Julie, you have one or two questions that you've been able to pull from our viewers?
Easily. I had more like 121 questions, but I think the most popular question, since we only have a few minutes, is around treatment. And you've talked a lot about the CBTI and sleep hygiene, or I like how you call them sleep promoting behaviors. But questions a lot about supplements, particularly melatonin is very popular amongst our viewers. So Nancy is asking if using melatonin is a good idea for someone with MS. And then Lisa said that she's used melatonin, but she wakes up feeling groggy. Someone else is asking about B12, whether it's as a treatment or maybe it's something they should be checking to see if that's contributing to feeling fatigued or not getting good sleep. What can you tell us about some of these supplements that people are using?
So melatonin, we could start there, because maybe it's a common question that I get asked. Is should I be taking melatonin? When should I be taking it? Why isn't my melatonin helping? And I think first of all, I don't necessarily, not being a physician, I don't ever recommend melatonin, but I have a lot of clients that are on it. And I think the biggest thing with melatonin is that it is effective for certain conditions. It is not generally the recommendation for people who have insomnia. Where melatonin becomes helpful is more so with circadian rhythm disruptions. So for people, we talked about how circadian rhythm and also sleep drive are the two main drivers of sleep. So for some people, that circadian rhythm can get shifted. It can get shifted earlier, so they go to bed really early and then they wake up really early, or they can get shifted late, so they're staying up really late but then sleeping really late. And for those people, oftentimes the recommendation is bright light exposure and then also melatonin, because that helps to shift that circadian rhythm. So that's one thing, is being mindful that you're taking melatonin for the appropriate sleep issue. The other issue with melatonin is that when you buy it over the counter, the potency of the melatonin varies dramatically. So there was a study that came out not that long ago that showed, for some melatonin over the counter, it's much lower. You're getting a much lower dose than you think you are. Whereas some other ones, you're getting a much higher dose than you think you are. So you have to be really cautious about the quality of melatonin that you're using. And then the other big issue is the timing and the dose of melatonin. So people oftentimes are taking way too much melatonin. So oftentimes the recommendation is closer to like 1 milligram of melatonin, whereas a lot of the over-counters are starting at like 5 milligrams. So that could be why people then are feeling drowsy or fatigued the next day. But then also the timing of it. And so a lot of times people take it at the incorrect time to be helpful for their sleep. And so again, the general recommendation is 1 to 2 hours before your intended bedtime. So that's, I guess, the issues with melatonin is both the potency, making sure you're taking it for the correct condition, but then also the dose and the timing. So that's why it's concerning when people are taking it. And especially if it's not being helpful, then it's likely that it's one of those 4 issues. And as far as other supplements, again, I think it's a matter of, having those lab works done and seeing, what may be a deficiency for you, and then talking to your doctor about, is it appropriate to be taking some sort of a supplement? Because for some supplements, and I don't know enough about B12 to say for sure this is true about B12, but some supplements can interact with your medications or interact with other supplements, and so you do have to kind of be cautious about what supplements you are taking, even though they are available over the counter.
Great. Well, thank you so much. I'm going to turn things back over to John to close us out today.
Thanks, Julie, and thanks to all of you who submitted your questions, and thank you again, Dr. Siengsukon, for joining us today. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and I think these are the resources that you can count on. I want to remind you that if we were unable to get to your questions today, the National MS Society's MS Navigator team is your best partner in answering your questions and connecting you to the very best information and resources. You can contact an MS Navigator by phone, email, or through the MS Society's website. I'd also like to acknowledge that we're in the midst of an emotionally difficult time for so many people. And I want to make sure that you're aware that the National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. You can reach them by calling 1-800-273-8255. If you'd like to learn more about sleep and its impact on MS, please visit the Society's website at nationalmssociety.org and search on the word sleep. You'll find additional information and resources that you can turn to. And for more information about Dr. Siengsukon's work, you can visit kumc.edu, and you can follow Dr. Siengsukon on Twitter at KatieSleepPT. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. With vital funding from supporters like you, the National MS Society will work to ensure that resources and programs like today's are available, and that the MS research community rebounds quickly from COVID-19, so the progress and momentum toward finding a cure continues. As you're able, please make a donation to the Society's COVID-19 Response Fund by texting the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. I hope you'll consider contributing today. And please remember, you can connect with the National MS Society on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And make sure that you're on the Society's mailing list so that you'll continue to receive the latest information on MS and updates on upcoming programs just like this one. I'd like to thank Dr. Katie Siengsukon for joining us today, and I'd like to thank everyone who's joined us for your great questions. Please remember that a recording of this webcast is going to be available for your review on the Society's website at nationalmssociety.org/MSExpert. And now I have a quick favor to ask each of you. Getting your feedback on today's webcast is important. So you'll see a survey pop up in a moment when we close out. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continually improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute and fill it out. On behalf of Dr. Katie Siengsukon and the National MS Society, I want to thank you once again for joining us. Please stay safe and make health